We can see here, and we will keep the marker part towards medial side. We'll keep it along the inguinal canal. And once we keep it here, we will locate the femoral nerve, pulsating round structure, and a femoral vein. And lateral to the femoral artery, first of all, we'll locate the femoral artery, a round structure, pulsating, and medial to that will be the femoral vein, and lateral to the femoral artery will be the femoral nerve. We will note the position of the probe in relation to the femoral artery. The femoral artery is split into two, so we need to move the probe upwards. Here, as we go a little down, the femoral artery splits into two branches, the superficial and deep. So we will keep it at a point where femoral artery is found as a single round structure, not as two, not divided. Then we will go a little lateral to find the femoral nerve laterally, enclosed in a sheet formed by the fascia iliaca.
Interest?
Yes. Yes, now you can see. First, I would like to see the femoral vein as well. This is the femoral vein, medially pulsating, compressible round structure, and then lateral to it is the femoral artery, which is incompressible round structure and pulsating. Then lateral to it, this white hypoechoic structure lying in a fascia that is formed by the fascia iliaca. This is the femoral nerve.
This is iliacus muscle.
Yes.
The fascia of the iliacus muscle is the fascia iliaca. So it is actually traveling on top of the nerve. It's covering it. Okay, it's going like this.
Steadily. This fascia iliaca moves on top of the nerve, as Dr. Umair mentioned, and it travels down the artery like this. It does not move like this. So it moves down like this. So if you give drug here, so it is not going to block this nerve, femoral nerve. So you are injected, and make it a little more clear. So your injected should be inside or below the fascia iliaca. This is the femoral nerve. Okay. So if you move a little more laterally, we are going to find lateral femorocutaneous nerve. But before that, we are going to see the landmark on ultrasound. The landmark of the ultrasound probe. Once the femoral nerve is identified, or the femoral artery, femoral vein, femoral nerves are identified, and the probe is moved laterally. And we are going to see a sartorius muscle and the tensor fascia lata on the ultrasound machine. And in between these two, there is the lateral femorocutaneous nerve traveling down. Femoral artery, femoral nerve,
This is a sartorius. So first of all, we have to find the iliacus muscle. Okay. So this pitted muscle here is the iliacus muscle. Okay. This pitted muscle is the iliacus muscle, right? A very important landmark. The only way you can find LFCN is through this way. So again, femoral artery, femoral nerve, iliacus muscle. Ab hum jayenge laterally. We're going to go laterally until you see one muscle above the iliacus. This muscle up here. See, as you move laterally from the artery, watch the iliacus. Where it ends, there's going to be another muscle just above it. इसको कहते हैं sartorius muscle, ठीक है? The sartorius muscle. The sartorius arises from the anterior superior iliac spine, okay? Just lateral to the sartorius muscle, you're going to find the tensor fascia lata muscle. Okay, this is the tensor fascia lata muscle. So again, slowly, this is a tricky block. This is quite a tricky block. So again, you found the artery. Okay, you found the artery. You found the nerve. इसकी जो muscle है, ये बड़ी सी belly. This is the iliacus muscle. All right. As you go laterally, तो एक दूसरा मसल पिक्चर में आ जाएगा, इसको कहते हैं sartorius muscle, ठीक है? अब sartorius को फॉलो करते 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 आप जाएं तो you'll see another muscle, इसको tensor fascia lata कहते हैं, tensor fascia lata, ठीक है? In between these two muscles, sartorius, tensor fascia lata, there is an area, we call this the fat pad, ठीक है? A fat pad, okay? Now inside of this fat pad, you can see a cherry-shaped, wonderful lateral femoral cutaneous nerve, a little cherry sitting in the fat pad. और मुझे स्क्रीन पे नजर आ रही है, it's looking very clear and wonderful, ठीक है? We can follow this cherry down, and it will now split into two branches. Let me see if I can get it to split. Actually, it will come on. So, like, yes. Now, see this muscle here, this nerve here is splitting into two branches. Here it's whole. As I go distally, it is now split into two branches: posterior branch, anterior branch. Posterior branch, anterior branch. So you should generally expect to see two or more branches. Okay. Again, tensor fascia lata muscle. Okay. This is the sartorius muscle. Okay. Between these two muscles, this, by the way, there's a second muscle down here, it's biceps femoris, but we don't use this as a landmark. We're using sartorius, tensor fascia lata. In दोनों के बीच fat pad है. This is a fat pad. In that fat pad, you should look for a little cherry, and that little cherry will be your lateral femoral cutaneous nerve. If you are distal, you will see two of them, and there's also a tiny vessel here. You won't be able to see it. Very tiny artery here right beside it. So now there are two branches, 1 and 2. You go proximally, ये दोनों branches जो हैं यहीं पे join हो गए, and they become one nerve, ठीक है? If you still cannot find it at all, तो sartorius के साथ ही आप laterally skin wheel दे दें. You can give a whole skin wheel, and you can also cover the nerve, just in case you can't see it. But in this case, very fortunately, we can see it cleared, ठीक है? Let me just freeze it and drop the screen about bright नजर आ रही है. अब ठीक है, ये nerve, ठीक है?
This is the approach, the in-plane approach towards it. You can come from any part. You can come out of plane, in plane laterally, in plane medial approach. It lies a little, it lies superficially, so there is no risk of damaging any major vessel unless you move too blunt far away from this medial.